Yeah, Angie, you need to unmute.
Oh, sorry. Yeah, I got it.
Alfonso, you need to unmute. Yeah. Yeah. Okay, we are going to start a webinar and I would like to welcome everyone. My name is Edward Chang, a professor of ethnic studies and the director of the Young Kim Center for Korean American Studies at University of California, Riverside. And this webinar will try to answer some of the questions we have on its impact on racial minorities. And today's webinar will be moderated by Sung Kim, who is a grad student in the Department of Ethnic Studies at UC Riverside. And let me turn it over to Sung.
Hello, everyone. So my name is Sung Kim. I am like Professor Chang said, I am a first year PhD student in the Ethnic Studies Department, and I'll be moderating today. So towards the end of the our webinar, we'll be opening up the chat room for Q&A sessions. But yeah, can we have the other professors introduce themselves?
I can go. Hello, everyone. My name is Gerald Clark Jr. I'm an assistant professor of ethnic studies at the University of California at Riverside. I'm also an enrolled member of the Kaweah Band of Indians, and I'm elected tribal leader.
Hi, I'm Angie Chung. I'm a professor over at the Department of Sociology in the University at Albany SUNY. So I believe I'm the one East Coast representation. And I've been doing some research recently on COVID-19 and Asian international students, as well as Asian Americans.
Hi, everyone. I'm Alfonso Gonzalez Toribio. I'm an associate professor in the Department of Ethnic Studies, and I'm the director of Latin American Studies at UCR.
Okay, so as you all know, this COVID-19 crisis is just super, crazy, and people of color, we have, we've been disproportionately been affected by this pandemic, and our webinar today is going to be focused on, trying to give a voice to our communities of color. Unfortunately, we couldn't find a Black perspective. I actually reached out to 7 to 8 professors at UCR, but none of them were available because of conflicting schedules. So hopefully, maybe like next time we can, get their experience and whatnot. But our first question that we have for the webinar is, how is the COVID-19 crisis affecting each respective community nationally and internationally? And how is the crisis, how does the crisis minimize and erase the suffering of each community? Can we turn it over to Professor Chang to answer first?
Yeah, for Asian American community, 2 issues stand out. One, the rise of hate crimes against Asian Americans. And number 2, economic difficulties, economic hardships faced by many mom and pop store owners. According to the FBI statistical data, between 2003 and 2017, the anti-Asian hate crimes went down 56%. But this year alone, we have seen dramatic rise of anti-Asian hate crimes, anti-Asian violence. It's very concerning. There have been more than 1,500 reported cases of hate crimes against Asian Americans is rising. And one of the reasons why that is, obviously, our leader, presumably a leader, President Trump, initially named COVID-19 virus as a Kung flu, right? Suggesting it was nothing more than a flu, but Kung flu. As the number of casualties, the person who are dying increased, he began to blame China and named it Chinese virus. Obviously, he's trying to divert attention and responsibility away from himself to China. And he's spreading xenophobia virus. He's spreading anti-Asian hate and anti-Asian violence and the crimes. So therefore, we are very concerned, and we need to respond united. We cannot tolerate this to continue as a number of Asian Americans who are being attacked is continuing to on the rise. So we need to stop. President Trump need to stop spreading anti-Asian hate virus.
Can we have Professor Clark speak on that question?
Yeah, so, you know, when one looks at indigenous communities, you're really looking at two different populations. You're looking at tribal communities that are in rural settings, in some cases extremely rural, and you know, placed far away from urban centers. And then you have the urban population of indigenous people. And in the case of, like, say, here in the United States, the media is covering what's going on with the Hopi and the Navajo and the rates of infection that they're dealing with. And you would think that these rural communities wouldn't be covered, right, in the media. But one of the things that you find, particularly with urban tribal communities, are that, you know, the United States, right, there was a formal policy of termination of tribal sovereignty, late 50s into the 60s, that moved indigenous peoples into urban environments in order, hopefully, to see them, you know, assimilate and slowly disappear. And those people have really become almost like an invisible minority here in the United States, and are often left out of these conversations. So, you know, what we see going on with, say, the Navajo, you know, increased rates of infection, and you know, the similarly, you look at indigenous peoples in the Amazon, and you see mortality rates that are double the populations of the non-native populations in the rest of Brazil. And the other kind of factor here, though, is that some of those populations that are so secluded and so outside of you know, urban environments, that the reporting rate is also, you know, we don't know if we can trust those at all, right? So the two populations, they're both dealing with different issues, right? And then I will tell you that this pandemic that we're experiencing now, we often talk about the, can everybody hear me? Am I still on?
Yep.
Okay, the screen changed, so I was questioning. Yeah. So like I participate in cultural events and ceremonies, and it really kind of hit home to me that so much of our traditional life and our ceremonies revolve around human interaction, touch, hugging, shaking hands. And so what we see, you know, like, is this infection rate might be higher. And I think there's part of this traditional culture, and it's hard to resist that when that's how you've spent your whole life, and it goes back generations. So these are some of the things that indigenous communities are having to deal with.
Can we go to Professor Gonzalez?
Can you unmute?
Yeah.
So Latinos are, I think, like all subaltern groups. By subaltern, I mean groups that are on the margins of the mainstream. So we're all subaltern in different ways: natives, Asians, indigenous people, Latinos, blacks. But Latinos, like all subaltern groups, occupy an oppressed sector within the U.S. political economy, and Latinos are overwhelmingly infected, precisely because we're in those service sectors that that society needs in order to survive. I'm going to give you 3 or 4 quick examples. The meat packers, the meat packing industry, it's majority Latinos in Yakima, Washington, in Iowa, and all these different parts of the United States, agriculture workers, service restaurant workers, and here in the Inland Empire, an hour outside of Los Angeles, in the warehouses, Amazon, UPS, all that logistics industry, that's the motor of contemporary capitalism, where consumption is still going on amid COVID-19. And those that have the racial and class privilege to consume are not in those warehouses, they're not in those fields, and they're not in those meatpacking plants. You know, Latinos are. That's why we're overwhelmingly affected. And if you look at, there was a recent mapping of coronavirus cases in Orange County, and to no surprise, the majority of infections were in Santa Ana. Why in Santa Ana? Because that's where the majority of Mexicans and Central Americans live that service in a very affluent county. So those people can insulate themselves, even as they do their ridiculous protests against the pandemic, but they're not out there working with the public every day, delivering food, mowing lawns, packing boxes, like the way the warehouse workers are out here. So that's how we're affected. But what I want to say that the key here for me is not just the particularities of our suffering, but what we have universally in common with other subaltern groups, with Asians, with natives, etc. Even though we are maybe suffering and have different histories, slightly different or significantly different each ways, the key here is that we're up against a structure of racial capitalism that's created political superstructure, states, universities, organizations that reflect those racial disparities. And that, for me, is the principal contradiction that we need to confront.
Dr. Chung, can we have you speak on it?
Yeah, Ed kind of started it off noting some of the increase in hate crimes. The FBI has warned of a spike in hate crimes in New York in particular. I just was interviewed for an article looking at how unemployment rates have skyrocketed for Asians, much greater than any other racial group and much greater than the proportion within the population. I believe it was something like 6,900% increase since last year. So certainly we have those aspects, you know, the media sensationalism. There have been some good pushback in the media since, but, you know, in the very early stages, we had these representations, certainly what some of the public officials and president have said, and also, you know, Asians in masks. The other thing I want to point out too, if we're looking at this from an international perspective, is I've been doing some interviews with Asian international students, and they're in a particularly difficult position, not only because they're subject to a lot of this kind of racial assaults, you know, in a lot of these cities that we're talking about, but they have nowhere to go. In addition, what was interesting was that because of this anxiety and fear that the pandemic could actually resurface in other countries that have been able to control the spread, a lot of them actually felt people resented their trying to come back. And so there were a lot of quotes, and you know, this isn't certainly representative of the entire country, obviously, but within certain small subgroups, you know, if you look at some of the commentary in some of the conservative newspapers abroad, people were saying, why is it that you leave when you don't want to pay taxes, but then you come back in order to take advantage of healthcare, which is much better in other countries. And so, you know, all this really highlights is kind of this middle man kind of position that they're stuck in between two worlds, but also that there are huge inequities that we're talking about, linking to what the other speakers are talking about. The fact that we don't have an equal healthcare system is very, very shaping what's going on here. The fact that there's segregation, the fact that there's a lot of misinformation being spread. I think this is something that you'll see across groups. So I think this is something that we need to really talk about as, you know, as minorities in this country. But I'll talk a little bit more. I think we have a question about that later, but I think we have to also look at this globally, how it's been affecting people who are, you know, stuck between nations.
Thank you so much. And just to quickly add, there's actually been a, this was on the news. I kind of read this morning, and they're talking about how some Republican senators, they were trying to pass this bill called the Secure Campus Act, which basically, you know, they're trying to ban all the international Chinese students from coming over to the US. and taking especially taking, courses in like the STEM fields and taking it back to, China and stuff. So they're actually like, naming this the new Chinese Exclusion Act. So I thought that was pretty interesting as well. So moving on to the next question. How can we compare these racial disparities amidst the pandemic to past histories, especially with how Trump's administration is handling the situation? And has it improved at all, or are there no changes or little changes from the past, or how does it differ? Professor Zhang?
Yeah, I mean, unfortunately, we've had a long history of anti-Asian exclusion, discrimination, and racism, particularly here in California. We're the leading state as far as anti-Asian violence is concerned, beginning with Chinese Exclusion Act of 1882. For the first and last time, the single ethnic group was targeted for immigration exclusion in the United States. And we've also had a long history of alien land law in 1913, anti-miscegenation law of 1880, which prohibited interracial marriages between whites and primarily Asian immigrants. And we also has this issue of Asian Americans consistently being portrayed as perpetual foreigners. And therefore, we had to prove our loyalty as Japanese Americans did during World War II. When Japan attacked Pearl Harbor, somehow Japanese Americans are responsible. When China became communist nation in 1949, somehow Chinese Americans are all of a sudden communist. And now COVID-19, and somehow Chinese and Asian Americans are spreading the virus. Back then we were viewed as unassimilable aliens, could not become citizen of the United States of America. It wasn't until 1952 that Japanese and the Korean Americans were able to become citizens of the United States. We were called disease carriers, germ carriers. 1970s and 80s, all of a sudden, we are the most assimilable modern minority. Now, 100 years turning clock back, now we are disease carriers, germ carriers. We are spreading this COVID-19. So we, as far as Asian Americans are concerned, we are about 100 years turning clock backward. And this is just sickening to me.
Professor Clark?
Yeah, I just mentioned the relocation program, and let's face it, settler colonial nations have worked towards the termination of indigenous peoples and the assimilation of indigenous peoples, which is a form of cultural genocide. So there's a long history of, in my case, right, the United States government and my people being denied, the treaty rights that were negotiated, 150, 250 years ago. And that has resulted in, the lack of funding, right, for education, the lack of funding for healthcare. And going back to what Professor Gonzalez had mentioned, this relocation program, the tribal people were promised education and they were promised jobs. But it certainly wasn't rocket science that they were being promised, right? It was basically the service industry. And so, the people who in terms of what's going on right now in America, it's the American worker, and indigenous peoples are part of that population who are being subjected to, right, this exposure to the virus. And this, as far as any changes with the current administration, this is a long history of neglect, a long history of using federal funding, right, to under support, right, under the ability of the government to supply the Indian Health Services and to supply tribes. The CARES Act, there was $8 billion that were promised to tribal nations, and the Department of the Treasury used outdated data in order to divide up those funds. So some tribes were given funds that were over the need, and some funds or some tribes were given funds that were much less. So the detachment, I think, of mainstream America and also of the federal government and the federal Indian policy of what's really happening in people's lives. Over and over again, when you look at American history, the United States has taken a one-size-fits-all cookie-cutter approach to tribe and tribal nations, and every one of them are different. They're all unique tribal communities, and you can't address them all with one program, right, or one approach. And this is where the United States has really fallen short with the COVID issue.
Professor Gonzalez, may I have you speak on this as well?
You need to unmute, Alfonso.
Yeah, to respond to the question, history never really repeats itself. Things are constantly changing, but there is constants and then there's change. I'm glad the Chinese Exclusion Act was mentioned. Practically the same year of the Chinese Exclusion Act, you get the rise of eugenics, founded by Sir Francis Galton, who was an Englishman who's the cousin of Charles Darwin. And the ideas in the 19th century were basically the late 19th century ideas of eugenics was getting Darwin's theory of the survival of the fittest and arguing that the reason why whites were so advanced and so more sophisticated than other groups is because their genetic superiority, that they had this genetic superiority over non-white people, and that's what had allowed them to advance in the sciences and civilization, etc. What Galton was actually doing was providing a theory to justify the pillaging of the world. The late 19th century is the age of imperialism, where the United States is setting up colonies all over Africa, all over Latin America. The French are in Vietnam. There's colonization of Southeast Asia. But ultimately what this eugenics ideology led to, and this is what's very dangerous about the moment, because eugenics is back with a vengeance, okay? What was so dangerous about this eugenicist era was in its extreme form, it led to Nazism and a real collapse of civilization. I gotta say that capitalism is inherent with crisis, and that crisis ended up in 2 world wars, World War I and World War II. And in World War II, right between those 2 wars, 200 million people died. 200 million people died, okay? With those deaths, after World War II, you get this post-World War II order. You get the World Health Organization, the Refugee Convention, the United Nations. But the most important thing to come out of World War II is a global rejection and discrediting of eugenics. The eugenicists had to go into hiding. They got discredited after World War II. And that, the Refugee Convention, the UN Declaration of Human Rights, this rejection of eugenics, of open white supremacy, is what led to the Civil Rights Act, what led to the Civil Rights Movement, Black, Asian, Indigenous, American Indian. But what we're seeing now with neoliberalism, we're seeing the return of neo-eugenics. And the neo-eugenicists, these people are in the freaking White House. Stephen Miller, Stephen Bannon, the Center for Immigration Studies, all of these think tanks that are driving immigration policy and designing these policies to exclude Mexican and Central American refugees, Asian students, they're guided by a eugenicist worldview, but it's a neo-eugenicist worldview that has emerged at this moment. And it's very dangerous because, not to say that there wasn't injustices against people of color after World War II, of course there was, but there was at least a consensus that to be an open racist was wrong. We had to hide it. But what we're seeing coming back is that to be an open white supremacist, it's back. This neo-eugenicist idea that we can survive the pandemic, only the old are gonna die, only the sick are gonna die, only Blacks and Natives and Latinos are dying, That is all consistent with eugenics, with the neo-eugenicist idea. And it's very dangerous, and it can bring us to another collapse of civilization. And I'll make this last point, I know I'm a little over time. By collapse of civilization, I mean this. In the animal kingdom, if you break your leg, you die. Humans, what defines a civilization is compassion. And when a human breaks their leg, well, there's usually an infrastructure to help them survive. But what they're doing with the pandemic and forcing people to go to work, they're making people die, making people face death. And if you cannot afford to shield yourself for the pandemic, well, F you, you're expendable. You're an essential expendable worker. And that's what's dangerous about the moment we're in. It's a type of dehumanization that can lead to a major collapse of civilization.
Thank you for that. Professor Chung?
Yes, thank you. I mean, I agree with everything that's been said so far, and so I'll just try to give a different, another addition to that, what's been said. I think there's a few things, certainly there's a lot of historical continuity, and Ed went over that. So I think what I'd like to talk a little bit about is what's changed. Number one, I think we have to keep in mind that there's been an influx of immigration after the 1960s that are very different racially, that are diverse class-wise, that are include a lot more women and children. And so because of this, the stakes are very different than what it was in the early 20th century when you had mostly European immigrant male laborers come in, and then obviously we did have Chinese and other workers come in as well, but they were much smaller percentage compared to what we're seeing today. And so I think some of the dynamics of this, this effort to push out immigration is very troubling and is, going to be difficult. And, it's not going to be good, not only for the immigrants, but also for the country itself. And that's something that we need to think about. The second thing too is that, again, I agree completely that we're seeing the resurfacing of very blatant eugenic type of racism going on. And I like that perspective that Alfonso gave in terms of, oh, it's okay if old people die or whoever dies, whatever, right? In addition, though, I think some of the subtleties of what Lawrence Bobo called laissez-faire racism is something we also want to think about. When I interviewed a lot of Asian Americans, we had some people who were physically and verbally assaulted that were very clearly evidence of hate crimes. But there are also many people who experienced microaggressions, people avoiding them, staring at them if they wore masks, people who yelled at them, but they weren't sure if it was because of race or because they were just very stressed out, right? And I experienced that myself too, is this uncertainty of whether or not this is a racially motivated attack or not. And so how do you actually share that with people and say that you were subject to racism if you don't know how to explain it yourself, right? And I think that's something we also have to, that are missed in these statistics on hate crimes, right? That hate crimes are more kind of the ones that you see in the newspapers, but those are the more violent and blatant types of acts. But what about the everyday lives and routines that people go through, right? And then lastly, this is an idea I'm playing around with, I'm not really quite sure, but I saw an article, I think it was in the Atlantic, and they were talking about how this may be, all these efforts to close down national borders, not only in the US, but in other countries, may be a sign that things are changing and there will be kind of a more tempered form of globalization that will occur even after the pandemic ends. And I wonder what kind of implications that has for people, again, who are stuck in between international students, immigrants, transborder migrants, and transnationally split families. So I think that's one thing. And the other thing the article mentioned was the possibility of these rising tensions in US and China are maybe symptomatic of a shift that's going on in terms of the global economic politics. So I think this may also change the tone of the type of racism that we see appear in the United States, and something that we also want to consider.
Thank you so much. That was super insightful. So let's see, how are we doing on time? Let's move on to the next question. So how has the idea of race and all its racist connotations been exacerbated during this crisis? And how might the COVID-19 crisis be further problematized when race is intersected with class and gender? Might there be wider gaps and disparities when compared with the larger white community? Dr. Zhang? So you have to unmute.
Oh, yeah. for Asian American community, obviously, the mom and pop store owners, nail shop, barber shop, or restaurant donor shop owners are devastated. I'm sure many of them will not be able to make it. And so that, economic aspects of it is detrimental to many, many mom and pop store owners. And at the same time, the workers, particularly female women workers, are working as a waitress, janitorial services, domestic services. They have a hard time, a double whammy, right? Not only they cannot earn income, but also, the domestic abuse within their own families. There is a serious matter arising. And one of the things that, contradicting this rise of anti-Asian hate crime is that in the United States, 1/3 of hospital workers, doctors, nurses, and hospital workers are Asian Americans. They are fighting against COVID-19 in front lines, right? And yet they're consistently being blamed for something they have nothing to do. So I think that's something that we need to continuously fight back and make a significant point that we are here as an American citizen benefiting not only for a greater good, but we are part of this mosaic of American society, that we have equal rights and we have a right to fight for social justice. I think that's the message that we need to bring out and have a conversation with other communities of color and fight against.
Professor Clark, can I get your perspective?
Yeah, one of the hot spots that I see here in the United States in terms of the interactions in this racial dynamic between tribal communities and non-native communities happens in these border towns. So you go to reserve lands, you go to federal reservations, and in these smaller towns pop up of non-natives, and a lot of times the economies are very much tied together. But what we're seeing, thanks to social media, is a lot of hate speech about, again, I'm going back to the Navajos, about how, they're dirty people, and, that's why they have this, this infection rate that they do, right? And of course, in that kind of hate speech, they're not recognizing at all the fact that, so many of the people on the Navajo reservation don't have running water. There's that failure of the history of treaty rights that I was talking about earlier, and it doesn't recognize, like Professor Gonzalez was saying, that many of these people are working in the service industry, they're working in food production industry, they're much more exposed, right, to other people. So, it's there's a long kind of American tradition of cherry picking information, right, and saying, oh, this is the reason, when it's discounting the entire history, right, of native and non-native relations. And then I would also throw out as well the availability of testing for COVID, right? We're seeing more and more, and I recently saw an article about testing services in Texas, and how, there are many more testing services available in cities and towns with a higher white population than with people of color, right? And I live on my tribe's reservation, and we have one small Indian health clinic here open on Wednesdays, and we can only get tested if we're showing symptoms, which of course by that time is probably too late. You've already got it, right? And so that's, I think about too, generationally, like if anyone knows about the Cherokee Trail of Tears that happened in the first half of the 19th century, and many people died when the Cherokee were removed from the southeast to Indian Territory, which is now Oklahoma. But that was only part of the story. The truth of the story was that many of those who died were the elders, who are, that's your past, that's your knowledge base. And it was also children, right, which are your future. And now, science is starting to understand that there are impacts on youth that are going to have, for decades to come, are going to have these impacts. And so this is the kind of, the cherry picking of information, right? Which allows many of these abusive, these kind of aggressive attitudes by, people against people of color.
Thank you so much. Professor Gonzalez? Oh, can you unmute?
You need to unmute.
Yeah.
Monzo.
So I was just in a panel with colleagues in Mexico City, and an excellent point that was made is that COVID-19 is not the beginning of the crisis, that there's a multiple cascading crisis. That is a crisis of capitalism, an environmental crisis, a food sovereignty crisis, and there's a crisis of democracy. And the neo-eugenics and neoliberalism over the last 30, 40 years is bringing us to this position where we're seeing a collapse of democratic institutions. Even the Atlantic, I have it right here, the Atlantic, which was a conservative, ultimately a conservative publication, they're talking about Trump completely destroying American institutions. And that's what we're seeing here. So COVID-19 didn't create race, didn't create racism, white supremacy, but what it's doing, it's agitating the conditions in which white supremacy, and especially through this neo-eugenicist ideology, it's coming back to justify a new moment in capitalist accumulation and exploitation, where you basically work or you die, and you work under any conditions. And it so happens the people who have to work under those horrible conditions are disproportionately people of color. You go to the casinos here in Los Angeles, Asians, Latinos, Native Americans. And I just want to make for the record, the line between Native Americans and Latinos, we've got to be careful with that, because many of the Latinos that are on the front lines of the service sector are indigenous people. You look at 80% of the gardeners in Riverside, they're indigenous Guatemalans. They're not really Latinos in the Latin sense of the term, but they're indigenous people. So that's what we're up against. That's what we're facing, and it's a very difficult moment.
Thank you for that. Professor Chung?
Yeah, I mean, as both Gerald and Alfonso have pointed out, the effect on workers, the people who have no choice in going out and doing work, and again, that a lot of minority groups, including, I mentioned earlier about the unemployment rates among Asians, they're not just the restaurant owners, but the workers who work in those restaurants. And those don't even include the undocumented, right? They can't apply for some of these programs. And so we don't know exactly how large the number is, but we certainly know that this is going to have a very severe impact on, all those groups. The other thing too is, you mentioned gender. I don't know, we're still trying to trace numbers, so we'll see how true this is, but in terms of safety, a lot of females I spoke with are just, they're very frightened, and they are often the subject of a lot of these attacks outside. And also, I mentioned earlier about transnationally split families. What's going to happen if we continue to restrict immigration and change the laws? What are going to happen to those families, right? Not just Asian families, Latino families, all those groups, right? And then the other thing that's been kind of bugging me as a parent myself is just, I think I read an article, it might have been actually LA, where, what was it, 15,000 students who have been MIA at school on the online schools. The impact of what this is going to do educationally for a lot of those students. I'm sure there's a huge percentage of Latinos and African Americans included, disproportionate to the population. What happens to them if we, during this interim, and also, overall in general, I mean, this is just not true for minorities, but abuse at home, right? So I think there's just so many things that could happen on many fronts that we just have not really anticipated. We feel like if the door is open, then everything's fine. It's not. Things are going to change after this pandemic, and I think that's something we need to keep in mind. One other point too, when I did this study, a lot of people were in quarantine, and so they were not going outside, nor were the people who could attack them. but they did report being assaulted. So what happens once we open the doors and they're out in those public spaces and people, blame them for what's been going on? I really anticipate the amount of hate crimes increasing significantly, right? And again, it's not just Asians. I think I've seen a lot of anti-Semitic remarks in New Jersey as well. This view that they've been going out and partying and spreading the virus has been spreading all across, I see it in a lot of the social commentary. And so I think that's the kind of thing we're going to see an enormous change in the post-pandemic period that we need to keep an eye on.
Thank you. Let's see. Let's move on to our next question. So how has this crisis become a setback and/or an impediment in gaining ground to working towards somewhat of an improvement of past race relations with the dominant white group and with other minority groups? And how might the US further divide minority groups during this crisis? Professor Chang?
Yeah, to me, it really doesn't make any sense. COVID-19 pandemic is a health issue. It's not a racial issue. It shouldn't be racialized. Whether wearing a mask or not, if you wear a mask, you're anti-Trump. If you don't wear a mask, you're pro-Trump. That's nonsense. It's beyond comprehension to me, right? Why is it a political issue when it's a health issue? And particularly elderlies are vulnerable, right? And wearing a mask is a common sense. Not only protecting yourself, but protecting your parents, your family members, your friends, your grandparents. And that should be understood by our leader, our President Trump, continuously even mimicking those of people who are wearing a mask, and he refused to wear a mask. That's a wrong signal, right? And we have the best hospital, the best doctors, best medical system in the world, and yet we cannot provide masks to health workers. They don't have a PPE. How do you explain this? And healthcare should be basic human rights for everyone, regardless of who you are. Now, unfortunately, our administration, Trump administration, Alfonso is correct. It's a continuation of eugenics movement. Those who are sick, those who are old, natural selection process will take them out. This is a totally inhumane policy, and we need to demand change. We must protest this very inhumane policy that Trump administration is continuing to pursue.
Professor Clark, can we have your perspective as well?
Yeah, continuing on to what Dr. Cheng had said, I see this divisionism really just the blatant inequality in the response of the federal government in terms of the protests that are happening now. Whether we see it in Minneapolis, whether we saw all the the open for business protests by mostly white protesters, and then going back to Standing Rock in 2016 and the reaction, right? A lot of people are talking about this on social media and creating their memes or what have you. Just this total inequality on its response to who happens to be protesting these issues. And so there again, just like the politicization of the health issue, right? We see the same thing with freedom of speech, let's say here in the United States, right? I would also point out too, that in terms of indigenous peoples globally, right, there's not a lot of incentive on these settler colonial nations, right, for solving the problem for indigenous communities, because these indigenous communities, many times, they hold lands that have been preserved and have not been mined, have not been, stripped of their natural resources. And so there's all kinds of encouragement for, these governments to allow these populations to diminish, to weaken those populations in order to grab those lands.
Mr. Gonzalez?
Can you hear me?
Yeah.
The crisis is definitely a setback, right? It said it was neither the cause of racial capitalism, neo-eugenics, neoliberalism, in this very brutal moment of capitalist accumulation. It wasn't the cause of it, but it weakens us because of the social distancing. I'll give you the example of May 1st. May 1st in 2006, Latinos took the streets. At least 4 million Latinos took the streets of the major cities: Houston, Los Angeles, Chicago, San Francisco, San Jose, Santa Ana, San Antonio. Well, with social distancing, you don't see the type of mass mobilization among Latinos that you were seeing before. In fact, this past May 1st, May Day, was the only May Day I recall that you didn't see major protests of workers and immigrant movements in New York and Los Angeles. Actually, this May Day, this May 1st, it was the right-wing paramilitary troopers that were out there in Minnesota, in Michigan, in Texas, going in with machine guns, these militias and angry white guys. That was a sign of the times. See, the problem with the moment, and I think Ed is right, is that this has become, the virus has become a cultural war between those that believe in science, those that believe in rationality, and those that have an unquestionable loyalty to their leader, to the point where he can send them into crowds in the middle of a pandemic, and they will do it all for their leader. These are very, very dangerous times. And I'm afraid that people of color are gonna have to get very creative and a little bold, and we're gonna have to start gathering to stop this. We cannot Zoom our way out of this. We cannot Zoom our way out of this. And I know it sounds contradictory because we know the pandemic is real, but unless we get organized and start taking to the streets and taking action, we're not gonna win. And this is not just about improving our equality vis-a-vis the dominant group. This is about living in a society where we can eradicate inequality completely, where we can eradicate racial conflict completely, or living in a society in which inequality and racial conflict become the hallmarks of a new society that we're living in. And that's what COVID threatens to do. And if this becomes a new normal, then the new normal is very, 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 very dangerous and scary. We can take a lesson from African Americans right now that have taken to the streets after the killing of George Floyd. The African Americans took to the streets of Minneapolis and Los Angeles, and they're taking serious action. I know that there's a virus going on. I know there's a pandemic, but historically, when African Americans take urban action, when they protest in urban centers, there's a shift in response to that. Well, when are other people of color going to do that? That's one of the questions. I'm not saying we have to riot, but when are we going to at least take to the streets?
Thank you for that. Professor Chung?
Yeah, this is an interesting question because I'm not quite sure where we'll be headed. Specifically, my research in the past has focused on inter-minority relations, so I was thinking of it in terms of that perspective. And what I was thinking, in particular before the pandemic, like two possible scenarios, right? One was this action suit against Harvard regarding Asian American admissions and how the lawyers kind of pitted Asian Americans against African Americans in terms of what they called quotas, right, at the universities, which is really not a good kind of description, I think, when we're talking about a holistic formula, right? But regardless, you saw a small group of, Asian Americans who supported this case, but you also saw a lot of voices, including some academics I know, who mobilized to, against this. And this was before the pandemic. But what I'm seeing too is, a lot of people becoming aware now that this is a big system of racial inequality that affects all, including, quote unquote, those who try to get by as model minorities, right? And, you know, when I was thinking actually of the Floyd case, in which we saw a lot of Asian Americans rise up and also protest the police brutality and murder of, you know, this African American person. And so it was interesting to see some of that discourse, because I see, you know, it going in either direction or possibly both, right? And that as people become more aware that, you know, they are treated as foreigners, does that mean they'll be able to connect with other groups or, you know, and overcome some of a lot of these differences to try to fight, you know, what's going on a larger scale? I think that would be an interesting to see in the future.
Definitely. Thank you so much for that. So moving on to our last question.
Can I clarify one little point that I said?
Yeah.
I said that we don't have to riot. I'm not trying to criminalize African Americans. And I want to say that the people who are doing stuff completely outside of the liberal democratic norm are the white supremacists. They're the ones that are showing up with guns and to intimidate lawmakers, to intimidate state governments. So for me, any action that people of color take right now to defend themselves is valid. I just want to make that very clear.
Thank you. So let's see here. So moving on to our last question. How can we collectively respond to combat racial disparities amidst this crisis? And how can we use this crisis to improve relationships between race and ethnic minority groups? And do you suggest any policies or initiatives that may, you know, benefit respective communities and communities of color as a whole? Dr. Chang?
Yeah, you know, one thing that I would like to make a note of it is a few days ago, the South Korean government sent masks and PPE to Navajo Nation, 10,000 of them. And yet our own government hasn't done anything, right? This is really, really ridiculous. And that's one of the examples that we must work together. One thing that I think we have to learn what worked, what did not work. You know, on January 20th, both the United States and South Korea reported first positive cases of COVID-19. And about 4 months later, this is where we are. You know, more than 100,000 deaths in the United States and 269 deaths in South Korea. So what does that mean? And what to do, what not to do, right? In South Korea, they responded quickly. Within a week, they developed test kits and began testing. In the United States, we did not test. President Trump said, it'll go away like a miracle. And when the CDC sent out the test kits, it failed. So it took another 2 months for the United States to actually begin testing. And in South Korea, they have a scientist as a control tower. They are in charge of policymaking. In the United States, CDC cannot do much since President Trump took over and politicized. And the scientists cannot really make policies. And in South Korea, they clearly showed testing is important. Contact tracing is important. Treatment is important. And in the United States, President Trump said, anyone who needs tests, they can get tested. He said that in March. And as we are approaching June, we still cannot provide tests to everyone who needs tests. In South Korea, testing was free. Treatment was free. In the United States, initially it was very expensive. I remember someone paid like $2,000 to get tested. Hospitalization is very expensive. In South Korea, they had a completely coherent policy of distribution of masks and PPE. In the United States, we still don't have enough masks and PPE. and wearing a mask. So it really shows what needs to be done and what we shouldn't do. And this is clear juxtaposing the United States, what not to do, and South Korea, what to do. And we know it's coming back again in the fall, right? So we need to take more proactive, preventive measures. So additional 100,000 people don't have to die here in the United States. And we need to work together. And I think other people can talk about what needs to be done, coalition building, how we can respond together as a one voice. And I just leave it at that.
Thank you so much for that. Professor Clark?
Yeah, so, you know, I'm an elected leader of my tribe, and what this is, you know, brought to my community, it's a small rural community, but we're looking at, like, it's really shown that the kind of lack of access to information, broadband services that we have in our community. And as Professor Chung had mentioned about the lack of education, right, for the children who have been out of school now for a couple months, that's a big concern for us. And then Professor Gonzalez mentioned food sovereignty, and indigenous peoples here in the United States have slowly been moving in that direction to return to our traditional foods and such, more as a quality of life and a wellness issue. But now, right, with food systems here and delivery systems here in the United States being questionable, right, that's even more important now. And I would say too, I see a movement as well as like urban intertribal community organizations who are starting their victory gardens and you know, patio gardens and things. And then also my community, we're looking at the diversification of our economic development. To, you know, previous to this, we had been talking about maybe building a grocery store for our community, which could have been a stock of supplies for our community when the stay-at-home order was ordered. But and I think the coalition building that Professor Chang had mentioned, I think that's these elements are not just for my community or indigenous communities, but I think there can be some coalitions built, right, where more and more communities, people of color can begin to take an active role as opposed to simply relying on these colonial systems, and we expect they're going to be there, and that's what the pandemic has shown us, that it's really fragile, right? And I would say the last thing too is the conservative kind of white protests that are happening in these state capitals. You know, it's all about freedom, and having to wear a mask is an assault on their freedom. And I guess tribally, you know, the way I was raised or whatever, you know, responsibility always trumped, sorry for that word, always trumped freedom, you know, and we have a responsibility as a community, we're a communal people, right? And I think, you know, in academia, right, and in public education, I teach an intro to Native American studies class. A lot of my students are just, they can't believe all the things that I'm teaching them that they didn't know. They're kind of angry about it, right? And so I think we can start very early on. We need to change the entire educational paradigm in this Western system to not just emphasize freedom, but emphasize this communal responsibility we have to all elements of the population as a way to strengthen. You know, it's really, this pandemic has really shown how fragile the current economic system is. And I think this is kind of something I'm going to be taking into my classes as we move forward.
Thank you. Professor Gonzalez? Yeah,
building on that point, you know, I think I think as Edward, Professor, he just said, look, there is smart policies that can be done, but this is way bigger than policy. This is about a systemic crisis of capitalism. Sure, there could have been smarter policies done to contain the pandemic early on, but you start reading the science behind this. You know, what exactly is this pandemic? This is the product of capitalism coming into conflict with the natural world and the natural world fighting back, right? There's this is coming from, this is happening in the food chain. This is happening literally at the fact that agriculture and meatpacking workers are connected to this should really scare us, because that's connected to our food chain. So even if we survive this immediate crisis, this is part of a multiple cascading, interlocking crises of capitalism with the natural world, of politics, etc. But I want to say this, that capitalism gave rise to the nation state system. Before capitalism was a nation states, it was kingdoms. It gave way to the nation state system. It went into crisis. It gave us this idea of the Enlightenment. Capitalism gave us the idea of rights. Well, capitalism is changing fundamentally, and as it changes fundamentally, so will the political superstructures to come out of capitalism. So something even more brutal, something with even less rights, something where the UN and the Refugee Convention and human rights and civil rights means nothing. And that's where it's heading. So this is way bigger than Trump. This is not about getting Biden elected, not even getting Bernie Sanders elected. This is about there having to be a paradigm shift. And this is why we have to be very proud and take serious the work we do as thinkers, because ideas matter. Eugenics was an idea. Neoliberalism was an idea. These were ideas that started off in think tanks, started off with scholars. They became the dominant ideologies of their time. So we need to think about how the ideas rooted in our community, especially in indigenous communities, ideas around of being communal, ideas of living in harmony with the earth, ideas of building compassion and cooperation with all our relations, including the animals. Those are not just superstitions. Those are ideas that have allowed indigenous people to last on this continent for 50,000 years, whereas capitalism and settler colonialism have only been around for 500 years. Settler colonialism, capitalism has been around for 200 years. And it's already bringing us to the brink of a civilizational crisis. So we got to think long-term about the ideas, because ideas matter. If you ask a Navajo, if you ask a Hopi, if you ask a Zapotec from Mexico, a Mam or a Cancobal from Guatemala, or an Aymara from Peru, if they're illegal on their own land, they'll tell you no, because the ideas are out there. You cannot be undocumented or illegal on a native land. These ideas are out there. The ideas that those who work the land belong. Those are ideas that are very, very old. So we have to elevate these ideas, because these are the ideas that are going to be the central pivots for building a new society, because the future of humanity depends on that. Even if we beat this pandemic, there will be another one, and another one, and another one. And even if we stop this racist law and that racist law, there'll be another one and another one, because those are inherent to racial capitalism. We've got to think long term, and we got to think outside of the Western European box. Thank you.
Thank you for that. Professor Chung?
I'll probably repeat a few things that people already said, because I completely agree with a lot of it. So certainly healthcare access, it's never been more clear that this inequality is killing our country. And thanks to Ed, I forgot to mention earlier that a lot of the people are very aware that we did a very poor job of handling this pandemic, but also providing equal access to all communities, minority communities, poor communities, rural communities, right? And this is something that we need to fix. This healthcare system is broken. Our past efforts to provide better healthcare are now being sabotaged. I think that we really need to think about this, especially in regards also to mental health. We're going to have huge, I think there was just an article out recently that there are a large percentage of Americans are undergoing depression, anxiety, stress. They're going to have to react to high unemployment rates after this and a declining economy. So I think that this is something we need to work, something that's common to all groups. The other thing too is I'm very concerned about what's going to happen to public schools and public universities that provide education to a lot of low-income and minority communities, including our own university. We're seeing efforts by DeVos to strip some of the post-pandemic relief funds from public universities to give it to private, and also same thing for schools, elementary schools. So it's just going to aggravate what's already a very unequal situation of education. One thing I forgot to mention too in regards to healthcare, especially because a lot of the fatalities and high, death rates are in the African American community, we have to get this access out there, and I think that's something that everyone needs to advocate. The discussion on the coalition, definitely. There's, Black Lives Matters. There's the oil pipelines on the reservations that are going on that no one talks about. But I've been reading a lot about this. That it's not in the news very often, but that's happened way before the pandemic and very quietly, might I add. We have to, recognize that this is destroying communities, and eventually it'll affect our own, whether or not we live in those areas, right? And lastly, also voter access. We have an election coming up. This is very important to hold people accountable for what they did and did not do during this pandemic, right? It's going to be troubling because I don't know how they're going to set it up if we're still in this quarantine or some version of it, because it's already been unequal, right? Voter access. So I think these are all issues, and I could go on. There's probably 300 other issues we need to deal with, but they've become aggravated by the pandemic.
Thank you so much for that. So let's actually open up the chat for some a Q&A session. So if you all have questions, can you type it into the chat box, or you can raise your hand and we'll allow you to talk on cam. Let me see. So while you all are, working out your questions, I had a quick question. So this is just for anybody. So a quick question, because we were lacking the Black perspective. How can we, as people of color, help support the Black Lives Matter movement, especially in this time during the incident in Minneapolis? What are some, active ways that our own communities can be involved in the Black Lives Matter movement?
I think, can you hear me?
Yeah.
Yeah, I think first and foremost, denouncing the horrific act of anti-Black violence against Floyd George. I think supporting the protest, not criminalizing the protest. I already see an effort to denounce it as just brainless rioting. And I caught myself, I wasn't trying to suggest that, but even I had to kind of clarify my position. And then there's a constant working there. But I think what's really, really important, is we have to really study the people who are pushing who are pushing the violence and who are really pushing the attacks on immigrants and people of color. And you have to study their thinkers. You can't just be reading other people of color, other radical thinkers. So I've been reading Camp of the Saints by Jean Raspial. And this was a book that was like the Bible to the anti-immigrant movement. This was like a philosophical, it's a novel, but it's become sort of like a sacred document to the anti-immigrant right. And what's very clear from this novel is that the novel's about third world refugees coming into France in the 70s, and the French not having the strength to stop the refugees. But if you look at the novel carefully, what they fear is unity between the Black and Arab immigrants and Black French citizens and Blacks in Europe with refugees and immigrants. This is what this novel, it's all about fear, about a unification of Arabs, Blacks, immigrants, and progressive whites. And this novel has influenced Stephen Miller, Stephen Bannon. This novel was Stephen Miller, who was the architect of the zero tolerance policies of separating women and children at the border. But see, they read this novel, and this was sort of a don't let this happen to you guide for white nationalists. And what they fear is exactly Black, Arab, Asian, and immigrant unity. And if that's what they fear, let's give them what they fear. Let's give them what they fear. Now they fear because they think we're going to destroy their world, destroy their country. But no, we're the last hope for this country, because you can't have democracy without compassion. You can't have democracy when you have the killing of Black people on the streets. You can't have democracy when you have children and immigrants, Latino immigrants dying in detention centers and dying at the border at the hands of Border Patrol agents. You can't have democracy if you don't have human rights. So
Thank you so much for that.
us struggling for our struggles is also a struggle for the Black struggle as well, honestly.
Thank you. I think somebody actually had a question for you, Professor Gonzalez. They said, so Professor Gonzalez mentioned COVID is a cultural war between science and loyalty. Was that correct?
Yeah, so these folks who are saying, I'm not gonna wear a mask, you know, they're not listening. I mean, it's like they're not listening to the medical experts, the disease control experts who are telling us wear a mask, but they have so much ideological loyalty with their state leader that they're willing to have a cognitive dissonance and basically ignore the science on this matter.
Okay. And also, so they were asking me a question, what was the name of the act you mentioned that was very similar to the Chinese Exclusion Act? That's the Secure Campus Act. Secure Campus Act. And it was an article that came out today. They were saying that it was like, it's like a new Chinese Exclusion Act because they're trying to bar, you know, international students from China from coming over to the US and studying like the major like STEM fields. And next question we have is by Brianna Ariola. How do you think other people who have physical disabilities going to suffer from this? Though not a racial group, they are a minority community. Deaf people who can no longer see lips because of masks not made for them, educational translators, etc. How is this exacerbated for people of color?
I think this goes back to my earlier points about certainly healthcare access. This includes not only being able to get that healthcare, but things that we don't think about, like mobility, right? Like how are the transportation services going to be set up? Will they be able to do it? How would they, you know, provide for those who need to be socially distanced when they go to school or, you know, go to work, right? Like I think those are interesting questions that will be raised. I mean, even before, not that this is related to the pandemic, but I was reading about the wildfires in California before the pandemic struck, and it very, very much affected the people who, you know, were physically disabled, right? When that hit, and basically destroyed a lot of homes and a lot of the facilities that they rely on. And I think, you know, certainly when we're dealing with health issues, this becomes even more of an issue. I'm sure they're, you know, even suffering now trying to get that kind of care in this particular environment and having to choose between, you know, being safe and socially distanced and get these types of services. So that's a very good question, and I appreciate it.
Thank you. We have another question here by Christopher Chibet. The idea that white supremacy is no longer looked down upon was mentioned earlier. Do you believe that this will continue to worsen or improve as hate crimes like that of George Floyd continue to rise to the surface?
It's not that white supremacy is no longer looked down upon. Clearly, a lot of people look down upon it. There wouldn't be the type of protests that we're seeing in Minneapolis. But what Trump and his neo-eugenicist immigration advisors and his sort of political advisors more broadly, what they're trying to do is bring back the idea that the disparities that we're seeing are just a product of white's genetic and natural sort of strength over, you know, vis-a-vis people of colors, and that's neo-eugenics. So they're bringing eugenics back and making it a mainstream idea and trying to have it accepted as just common sense. Oh, whites just work harder. Whites just are genetically more fit and don't get sick as much, versus the reality has nothing to do with genetics. It has to do with how racialized groups are positioned in the political economy. There's white working class people working at Walmart, in the supermarkets that are getting sick too. There's white postal workers that are getting sick too. But the white working class is also a sacrificial lamb to the dominant group, because they're not part of the dominant group economically. Even though their political allegiances as white people might be with white supremacy, they're still part of the white working class.
Thank you for that. So we have another question here by, I think it was regarding the, oh, here it is. Nikki Medized. They're asking, when talking about Asian American experiences, are Middle Eastern individuals included in that demographic? I am asking because Iran was another country hit hard by the COVID-19 crisis. So there are hate crimes targeted towards Middle Eastern people as well, particularly Iranians.
Well, this is a kind of a tough question. I think rather than COVID-19 crisis, September 11th crisis really hit Arab American community hard, and the rise of anti-Muslim, anti-Arab, remember that vividly. And Arab Americans are not technically part of Asian American classification, because Asian Pacific American is a category that are accepted and created and widely used. So it's more of a political will on the part of Arab Americans. What do they want to be identified as? I think that they have to pursue that political and social construction of race. How do they want to identify as? For example, Asian Indians during the turn of the century, 1910s, 1920s, were classified as Caucasian, a dark Caucasian. But now, in 1980s and 90s and beyond, they demanded to be part of Asian American movement. So they are now part of Asian Pacific American group and a movement. So in the case of Arab Americans, I think they need to come up with how they want to pursue their own social, racial, political goals. And I think it's very uncertain as of now.
Thank you.
All I have to say to that is read Camp of the Saints. It's a very racist book, but you see very clearly what they fear is Arab, Black, immigrant, refugee alliance with working class whites and with progressive whites. This has been the fear behind immigration policy over the last 40 years. You have to read this book. And they use the N-word, they call us cockroaches, they say the stink of the East, etc. But you got to get through it to see how these people think.
Okay. So let's see. We have another question here. This is for anyone. Do you believe that racism has changed or gotten better? We kind of answered that question early on. Or do you think it has changed the form in which it is presented? Additionally, what do you think are the positive, negative effects of social media being able to capture these acts of racism and make it accessible to the world?
I mean, it probably cuts both ways, right? I think some of the most blatant racist discourse I've seen has been on social media. And in fact, it was interesting. One of the students we interviewed said she's been able, a lot of these students try to find strategies to avoid or mitigate racist acts, even during the quarantine. And one of them said that the way she avoids it is not to go on social media because she just can't stand some of the things that she's been reading there, right? And so I think, in that sense, it's negative, but certainly it could also be a platform for organizing as well. I get a lot of my information in terms of organization and issues and what's going on that isn't highlighted in the mainstream media through social media. As long as you kind of vet what's legit and what's not, I think it could potentially have some uses. So it's an interesting question. I think it cuts both ways.
Thank you. Let me see, Joanna Shin. How do you feel about interracial violence within American society? As a Korean student, I've seen racism against Asians from non-white individuals, and this is racism being further accessed due to COVID-19. How can this be helped?
Well, it's not simply Korean, Chinese, Japanese issue. In the United States, historically, Asians were viewed as all look alike and perpetual foreigners. And so I think that that's the reason why we have Asian American identity. We are too small to begin with in terms of a number. So we had to come together as a one group to voice and raise our voice and raise our concern, protest. And that's the reason why in 1982 when Vincent Chin, the Chinese American engineer, was clubbed to death by two unemployed white automobile workers, mistaken as a Japanese. It doesn't really matter whether you're Chinese or Japanese, we all look alike. So that's a historical lessons that we have to come together as a group, and not only Asian Americans, but also Latinx, Native Americans, African American community. We have to respond courageously. We cannot remain silent. That's been one of the stereotypical image of Asian Americans being silent, passive. We have to confront it, we have to respond it, and we have to unite and respond together.
Can I say too, I think that interracial violence is, it's just scapegoating. It's looking for someone to blame. And it mirrors and reflects what the federal government and what President Trump is doing. Had the American response been appropriate, right? Had it been successful, I think we would be seeing some differences, less violence or what have you. But the lack of taking of responsibility of what's happening in the world by those who are in power, I think this is how it's manifesting in this interracial violence.
Mm-hmm. I completely agree with Gerald and Ed. I think part of it, I know it sounds like a very general answer, but I do think part of it is education, right? It goes down to understanding that our personal, individual, negative interactions with one person or, certain, kind of bad memories we have aren't representative of what's going on and what's really the source of the problems that we're experiencing, right? Where does it really come from? You have to understand the larger structure, right? If we're talking about back in the 80s and 90s when there were tensions between Koreans and African Americans, it wasn't just because, certain groups are racist or whatnot. I mean, obviously there were a lot of issues that we had to work out in that area as well, but it had to do with also the position that they were put in African American neighborhoods that were stripped of access to affordable food and banks and all these things, and Koreans were put there to become that middleman, but they couldn't provide those same services, right? And so I think part of it is really understanding that larger structure that creates all these conflicts and differences that we need to really kind of hammer that home. It's not about, oh, I had this one bad interaction with a Black person in the street, right? That's not really what's the source of your issues. And I think that people tend to get so consumed by these personal anecdotes, they don't realize what's really going on.
Definitely. Thank you for that. And let's actually make this our last question because we're running out of time here. So as more videos surface on social media about white privilege, such as people protesting to end the stay-at-home orders and refusing to wear masks, what can we do as people of color to combat this?
I think on the one hand, I had mentioned the need for Latinos to take action. May 1st was really sad to see that there was no Latino actions, no Latino immigrants out there usually like they are in the labor and immigrant rights movement, and to see these white racists out there. I think we got to be creative. I'm not saying we need to go and do like these beach parties that they do in Orange County where everyone gets sick afterwards, but there's got to be some type of taking of the streets in a smart, intelligent way. Like right now, a boycott of the meat industry would work. I mean, the meat industry is weakened. The meat industry has been a target of raids, Tyson in Nebraska, in Washington State, all over the place. The meat industry is heavily African-American and Latinos, but there is no national leadership. So we got to take action. We got to get to the streets. And I think the most important thing is we need to look for commonalities with other people of color, with other working class people. Too often, including on our own department, I see these like arguments about over who's the most oppressed. Well, we can sit here and argue about who's the most oppressed, but if we continue to do that and don't find the basis for unity, then there'll be a major civilizational crisis where we'll all be extremely oppressed and we're not going to have any changes and the benefit for any of us. So this is where I think one of the things that we have to do to combat this. We got to combat this ultra subjectivity that's only about my oppression and my group, and think about our particular struggles and how they're part of a universal struggle of subaltern people, be it the Aborigines in Australia, be it Arabs in France, be it Jamaicans in England, be it Black Americans, Native Americans, Latinos, etc.
Thank you so much for that. So we are out of time, and I just want to thank all the professors on the panel. I know Professor Gerald Clark. He was a last minute panel member because originally we had Larry Smith, but he's sick, and hopefully it's not COVID-19, but he was sick. So Professor Gerald Clark was awesome enough to substitute last minute. And Professor Gonzalez, thank you so much. Professor Chung, thank you so much, and Professor Zhang for putting this all together.
Yeah, as a co-organizer on behalf of the Young Kim Center for Korean American Studies and Ethnic Studies, I would like to thank every speaker, participants, and I also would like to thank everyone who joined us via Zoom webinar, and hopefully it was educational for all of you. And stay home and be safe, and hope to see many of you on campus on fall. Thank you. Bye.
Bye.
Thank you so much.
Thank you so much.
Thank you.